Welcome, and thank you for joining us for this short demonstration of how easy it is to create a digital impression using iTero. This video will cover ergonomic tips for comfort while scanning, as well as the 5 easy steps to a full-mouth digital impression. The buccal, incisal occlusal, lingual, bilateral bite, and palate segments. First, good ergonomics are essential during scanning. Set the foot pedal on the floor so you can easily reach it, and rotate the monitor to a comfortable position for viewing. Place the cart on your dominant side. This will make it easier for you to access the wand and mouse. It's ideal to sit at the 12 o'clock position behind the patient so you can easily view the monitor. To prevent fatigue, lower the patient so you're able to keep your elbows low and to your side. Make sure that you're able to sit and view the screen without needing to twist or stretch. Let's begin. Starting on the left lower quadrant, the first image is the occlusal of the terminal molar. Place the wand flat on top of the tooth, being sure to capture the distal wall. To stabilize, use your free hand to create a fulcrum. Tap on the green pedal to capture the picture. To capture the buccal surfaces, begin by rolling the wand from the occlusal to the buccal at a 45-degree angle. From this angle, you'll be able to see the full buccal wall and into the occlusal cusps. It's easy to capture 2 millimeters of gingival tissue from this angle. Use a rocking motion on the buccal segment to capture the interproximal surfaces. Rock the cord end away from the chin to capture the distal interproximal surfaces and towards the chin to capture the mesial surfaces. Continue this rocking pattern until you reach the midline. If areas of red appear, simply capture that anatomy before continuing. Areas of blue, no matter how large, do not need to be filled in. Tap on the red pedal for menu, where Next is pre-selected. Tap the green pedal to move to the next segment. Next, capture an occlusal scan of the cuspid. Place the wand flat on the occlusal surface of the cuspid and tap on the green pedal to capture the image, and then move to the next segment. To capture the lingual surface, position the wand with the cord end facing up. To help with retracting the tongue, keep the lens in contact with the teeth. Begin at the most distal molar and capture the interproximal surfaces of the lingual using a twisting motion. Twist your wrist left and right to capture the distal and mesial areas as you move towards the midline. It's important to hold the wand steady while scanning. If there's movement after you tap the green pedal, you may be prompted to please retake scan. If this occurs, simply stabilize the wand. After you have completed the lower left, you'll be prompted to continue to the lower right, followed by the upper right, and finally the upper left. After all 4 quadrants are scanned, you will be guided to capture bilateral bite scans. First, have the patient open, insert the wand, and close in centric occlusion. Gently rest the wand against the buccal surface, being careful not to move or rub the wand against the gingival tissue. Observe in the viewfinder that both arches are evenly split by the vertical line. For the palate segment, begin by positioning the wand tip behind the centrals, touching the tissue. Tilt the cord down for the scanning tip to easily access the palate and capture some of the tooth anatomy in the image. Move the wand back slowly, capturing consecutive, overlapping images until you reach the soft palate. Next, bring the wand back to the anterior of the mouth and begin to capture the palatal tissue bilaterally. Once all scanning segments are complete, select View to evaluate your digital model in high resolution. When you're ready, send your case by clicking on the Send button. Thank you so much for your time and attention. Your business is important to us. For additional support with your iTero scanner, please contact iTero support at aligntech.com or call 1-800-577-8767.